Okay, again, I apologize. I just don't know what's going on here with the Zoom. Unfortunately, um, it's been a little annoying. But anyway, so as I was saying earlier about the case history and its importance, proper documentation is, again, I was alluding to the electronic medical record. And so the electronic medical record is a way for us to store all of the information that we have gleaned from the case history into an electronic format so that it's much easier to access. So we have the documentation of all of the medical procedures, all of the medications they may be taking, any kind of assessments, anything that we need to know. So it's important that when we collect um, the case history information, that we collect the proper documentation. Sometimes we get addresses wrong. So those things are very important and is one of the reasons why the case history is of utmost importance. It is an art form. Um, I asked if you guys were listeners or talkers, and I feel like a lot of you were listeners, and really being a listener is an excellent way to become a, a good case history taker. Um, you kind of have to practice the art of listening if you're not used to it. And a case history, it requires practice, it requires patience, and it requires understanding on both parts. It's not something that you should rush through, and it's something that takes time to learn. It's not something that you are going to learn the first go around. It gives you an opportunity to practice these skills, and as you move forward through the program and in graduate school, you'll become much more skilled at taking a case history. I get a lot of the case histories um, for the students that I serve, at least at Maryland School for the Blind. I get most of their case histories from the parents. Sometimes the kids aren't really good at it, so it's important to involve as many people as possible when you're taking a case history. The setting when you collect a case history should facilitate good eye contact between the client and the clinician. So it's not something that you should be sitting away from each other or across the room. Distance should be minimal. I know that we're practicing, safe distancing, social distancing. Um, so 6 feet is adequate. But in order to collect a good case history, you really should facilitate good and maintain good eye contact while you're taking this information. You should be, as the clinician, warm and welcoming. That means that when you're collecting case history information on each other, you should not have your computers open. You should not have your phone around you. There shouldn't be um, food. You shouldn't be looking around the room. So if you don't have all of those things, then you don't have to worry about being distracted. Being distracted, especially when you're working with a real client, is going to tell that client that you're really not interested in what they have to say, and they may not end up being your client. So your full focus and your full attention should be on the client. It should not be on your phone, on a computer, or anything like that. I know that when I am at my physician's office, they walk around with an iPad and they have a little pen, and they're writing stuff and pushing numbers and stuff, and they don't really maintain eye contact with me. And that seems cold and impersonal. Today, when we were doing a lot of appointments at NIH with my son and my daughter, I didn't see one person carrying around an iPad or typing away on a computer when they were taking all of our information. So the more personal you can be, the more welcoming you can be, the less distracting you can be, shows the patient that you're interested in what they have to say and that they will be a good potential client for you. So minimal distractions, maintain eye contact. You guys should have had the opportunity to look at a few of the case histories that I posted. This is just one I posted over here, is a picture that I found online. I'm not saying anything good or bad about this picture. It's not that I do not believe it's the same one that is posted on Moodle. At any rate, when you do a good case history, your case history should, excuse me, in addition to identifying information such as name, address, date of birth, personal physician, it should include the complaint that the patient is experiencing or coming to you for, a history of that complaint. So, as an example, you may have a patient coming to you uh, who has experienced hearing loss. They may have been experiencing hearing loss, or the history of their hearing loss may have been a few years coming. So we want to know how long, when they first noticed it, did it get worse, those kinds of things. Any past medical history. Certain medications are ototoxic and can cause problems with hearing. So we want to make sure that we take a thorough medical history as well as a thorough pharmacological history. I always have patients ask me, why do you want to know what medications I'm taking? Well, one, some medications are ototoxic. Some medications are vestibulotoxic. So they can cause hearing loss, they can cause dizziness or off balance, or both. So the pharmacological history is important. Some medications prevent us from being able to take an ear mold impression with certain types of material, because if they're on blood thinners, we could pull very thin skin out of the ear canal. So all of these things, if it's on the case history, it's worth asking and it's worth reporting. Even if the person doesn't have any kind of information to add, it's important that you asked. So if they don't have any history, then you say NA or no history involved for any of these. Same with family history. So if a patient has a family history of hearing loss, that's important for us to know. It kind of directs us in a different path. I mean, we're still going to assess and figure out, but it gives us the opportunity or a way to figure out what else we need to look at. And social history. Social history is especially important for older adults because if they have hearing loss and they are socially withdrawn, that's important to know. Do they go to church? Do they go to the movies? Do they go out to dinner with their friends? Do they see their family? Those are things that we need to ask and know about. And so the more information that's on a case history, the better the case history that you're going to collect. Again, even if they don't have anything or don't report anything, it's better to ask and not know than not ask and then find out later that it could have contributed to a problem. Questions should be asked not as yes, no. They should be open-ended questions. So that, one of the first questions that I ask when patients come in is, so what brings you here today? And that's an open-ended question. It's not, do you have hearing loss, which is a yes or no, or even a maybe because they don't know. So we want to use as many open questions as we can, followed by questions with options. Would you be interested in doing hearing aids or cochlear implants or just oral HAB? And then leading questions where you're trying to get them to get to an answer like, so you say you have dizziness. So is that the kind where you're spinning, or is that the kind where you kind of are off balance and can't walk straight? So we want to, all of those questions are open questions. Asking questions with options and asking leading questions are types of questions that come with experience and as you do case histories. And when you get into grad school and even as a professional, you'll become more adept at asking questions. But the important thing to do is ask the questions. Never hand a patient the form and have them fill it out. When patients come into our clinical centers, I typically give them kind of HIPAA forms, Privacy Act forms, consent forms so that they may be recorded. All of those things are very important. They're very important things that patients can fill out on their own. But when it comes to case history, it's important that you connect with the patient. So you are asking the questions rather than handing them a form and having them fill it out. That's a best practice, and we need to really follow best practice when we're collecting any kind of data from a patient. Because remember, it's going to be part of their long-term electronic medical record. And if other people are seeing them as well, it's easy for them to pull out information that might be important for someone else who's treating them. Also, you want to summarize what your patient told you. So if they say they have hearing loss and they say that they've had it for a long time, you want to indicate that you heard them say that they have hearing loss. I heard you say that you had hearing loss. You're not sure how long you've had it. And then, that's a great way to segue into, what to expect from those procedures. A lot of people are very nervous when they come in for any kind of medical treatment, whether it's audiology, speech language pathology, oncology, you name it, people are nervous. So it's a great segue after they tell you, I think I have hearing loss, that you can say, well, you know what? I'm going to be able to find that out today. This is what we're going to do, and this is what each step of the way measures. So it's important that you let your patient know that you heard what they had to say, and that you can give them what to expect from the procedures and how that might affect getting that information. Now, I realize that each and every one of you are probably have no medical issues or no history or problems with hearing loss. Even if there's no history, you still want to collect it, you still want to report it, and you also need to put that information into a report. That's what a case history is, and good luck collecting it. I hope you have fun with it. I always enjoy hands-on experiences, and I hope you do too.